All right, my people, listen, we got some goodness here for the brothers. We are talking about men's health and we trying to all get our shift together, but I think this may be the first. Is this the first time in the Get Your Shift Together Men's podcast that we have the urologist of urologists? Like this, he is the top urologist for Black men's health. I'm speaking that. And he's my brother too. Dr. Quinton Cancel. Is this your first time in the building?
I believe so. Thank you.
I know you've come to other platforms like the Winning Circle and stuff like that. He has always been like our resident men's health guy in the Winning Circle. But anyway, we're going to get right to it. Doc, tell us a little bit about what you do, your experience. Man, how'd you become the Man Region's doctor? Talk to me, man.
And that's a long story. I don't know if we have time for that, but
Cliff notes, yeah.
Yeah, I've been practicing now for about 14 years. I trained at Duke for med school and residency. I went to undergrad at WashU. My godfather, Flip, his dad, my godfather, he's a urologist, and he's the one that got me interested in urology. But I was very resistant at first because I had a very limited knowledge of what urologists do, very crude knowledge of what. So we would go over his house and it'd say, hey, your dad's a dick doctor. Yeah, we got to cover ourselves up when we check us. Don't try to check us when we come in. So no, but that's kind of my introduction to. But as I got through med school and kind of looked at all the specialties, I just found a home in urology. I love the vastness of what you can do, the technology. I play with lasers and robots. I get to help men, particularly what we're going to talk about today, sexual health, medicine, low T, ED. But today we're going to talk about vasectomies, and that's really a hot topic, man. My vasectomy business has shot through the roof this year, and you probably can guess why.
No, I can't. Honestly, you kind of tipped me off on some of this earlier, and honestly, my head is still shaking about this. And by the way, for those of you guys who are joining in, please like, share, and subscribe to the Get Your Shift Together Men's Podcast. We are joined today with Dr. Quinton Cancel. He is the urologist of urologists for Black men, and he hails out of Asheville, North Carolina. But Doc, our subject today is it's not men in the church. That's the wrong subject. But the subject here it is to snip or not to snip. There we go. Talking about vasectomies, and you said some stuff, man. I was like, what? Come on, open this thing up, man.
I'm glad you asked me to talk about it because I've been seeing this shift in men coming into my office wanting a vasectomy, and they're getting younger and younger. And, I started asking, why is it, why are you here? And the answer I keep getting is Roe v. Wade. Is that decision that was made by the Supreme Court earlier this year. And even though North Carolina is still
this is the abortion law that was overturned, protecting women's reproductive rights and so forth.
Correct. And so guys are coming in their 20s, they're not married, they don't have any kids, and they're like, I want a vasectomy. And I'm like, wait, hold on. You do know this is permanent. A permanent form of birth control. And they're like, yeah, I just don't want to have kids. And I don't know how you know that in your 20s, but a lot of them are basically saying they want to stand in solidarity with women, as far as, protecting them from having to make a decision that may be illegal in some places. So, but yeah, it's crazy.
Whoa. Okay, Doc, break that down for me, man. Honestly, that's the first time I've ever heard anything. What do you think about that? I want your professional opinion and your man opinion. As a brother, keep it 100. What do you think about that?
Man, I have pause when I see someone coming in that's that young. My partner actually had a guy come in that was 18 and wanted a vasectomy. And before you even saw him, he was like, there's no way I'm doing this vasectomy on this guy. That is way too young. And then after he met him, he was like, I'm definitely doing a vasectomy. This guy doesn't need to procreate. Like, I guess, I don't know what kind of interaction they had, but in all fairness, you think about it, Myron, your 21-year-old self, you know, trying to make a decision for your 30-year-old self. That's kind of how I look at it. And I'm a different person than I was when I was 21. Yeah. And I think a lot of guys go into, well, I don't know this for sure, but I think there's a perception out there that vasectomies can be easily reversed. And there is something called a vasectomy reversal, but there's no guarantee. And so, you know, I feel some kind of way about doing young men, particularly if they're not married and don't have kids. And I grill them very, you know, intensely.
I was going to ask you, what do you say to them when you see a younger guy coming in? And he wants a vasectomy. What are you saying to them?
Yeah, I do. I tell them, hey, you know, this is permanent. This is meant to be permanent, and you absolutely don't want to have kids. And and some of them have alternative lifestyles as well. You know, they're just like, I'm just not. You know, I'm not. That's not in the cards for me. I've always known it. You know, and you know when they come in resolute, and if I sense any, you know, any uncertainty about it, then, you know, I will say, hey, why don't you think about it, you know, and come back after you thought about it and we'll talk. But, you know, in general, like my job is to treat the patient and what they want, you know, regardless of my own personal feelings. And so if they are competent to make their own decisions, they're an adult, you know, I have to abide by their wishes. So I may not agree with it and I may think it's not wise, but I can't really, you know, use that to tell them no.
A lot of brothers, and I think you were not my urologist, but you were the urologist of a lot of my friends. I mean, a lot of my brothers have come to you. Mm-hmm. And I just want to ask you this because, you know, a lot of dudes are hesitant about doing this, but they do find themselves in a position where they don't want to have more kids. And I'm seeing a lot of oopses. Matter of fact, I told you of a situation that I'm always reminded of a friend of mine who was born when his mother's tubes were tied, actually. I didn't know that was possible. I mean, yes, I mean, but there's always these, you know, and everybody's got their way. Some brothers got the pull-out game. You know, they got that mastered, but I'm talking about not necessarily the younger guy, but what goes into the decision-making process, or what can you say about a guy who is just afraid of anything happening in his man regions, but he doesn't want to have kids? Yeah. Should he or should he not get a vasectomy? If so, why or why not?
Yeah, no, this is so common. And honestly, it's mostly in your head, honestly. You know, we just have this fear of, you know, sharp objects or, you know, somebody manipulating down there, you know, it's just like.
Yeah, we might sing high, we might talk higher when it's over or something.
Yeah, yes. You think you're going to come out limping. I don't know. But it really, I tell guys, you know, they come in nervous and I get that. I was nervous. You know, we both have had vasectomies and so I understand that. And that's why I typically write for some Valium to take beforehand. So that takes the edge off. And I tell them it's a 10-minute procedure. In my hands, it doesn't take long.
Oh, it's 10 minutes now? It was 10 minutes when I got it done. It wasn't long, but 10 minutes, man, you really mastered this thing.
No, I really do the most in my practice. It's not uncommon for me to do, you know, 6 in a day, you know, in a session, in a morning session or afternoon session. And, you know, we use a no scalpel technique. And so that's usually comforting to guys to know that, hey, we're not bringing out the scalpel. We're not cutting you actually. So first of all, the Valium relaxes you. And I talk them through the whole thing. You know, it's really nothing to fear. You just fear the unknown, what you don't know. But there's plenty of numbing medication. We basically take a little device.
I was going to say, walk us through so a guy can know exactly what's going to happen to him if he decides to do a vasectomy.
So I will just counsel you like I would a patient. So I tell them basically, you want to come in shaved. You don't want hair in the field. So, you know, clean up down there. Yeah, clean up. If you don't, we have people that can. But then we after we get you prepped and draped Then we go through the midline, and there's an injection of local anesthetic that we put in the skin. And I actually numb up the vas at the same time as I'm doing the local. So everything is numbed up. And so I take a little sharp hemostat and I go in and poke the skin and just spread it open. And then there's this little vas loop that I use to grab the vas and to pull it slightly out. And there's a sheath that covers the vas. So we use a cautery pin to open up the sheath, and then that vas gets exposed, and we pull it out.
What is the vas in layman's terms?
Yes, so the vas deferens, we call it vas for short, is a tubular structure that goes from the epididymis, which is in the back of the testicle that carries sperm from the testicle. And it actually is a very long tube because it goes all the way from your scrotum. It goes into your inguinal canal. It turns into your pelvis and dives into your prostate to join up with your seminal vesicles at the ejaculatory ducts within your prostate. So your seminal vesicles is where the semen is stored. Okay. And so your semen and your sperm join together in the prostate and they flow out together. And so that's why you still produce fluid after a vasectomy, because 90% of the fluid is coming from those seminal vesicles that sit behind the bladder.
On a scale from 1 to 10, what is the pain experience from anesthesia to the actual surgery?
It shouldn't be anything, but what the comment I get from most men, particularly when you're numbing things up, is, that feeling like when you get grazed down there.
Yeah.
You kind of feel that in your stomach a little bit.
Yeah.
But most guys, I'm like, are you okay? And they're like, oh yeah, it's fine. Go ahead. So
I didn't feel that until after the surgery, when they told me to ice it down. I thought I could just, I thought I was strong enough to just go to the mall and hang out. And brother, hey, look, I was like the elephant man. Hey man, I had to go. I went home and got some frozen peas and just sat on them all day. But other than that, man, it was painless.
Yeah, it's supposed to be. That I say at the most you may feel that. If the surgeon is skilled and you hit the vas, you shouldn't feel much at all. And we do the same thing to the other side through one opening, and the opening is literally that big. That's my camera. That big, and I put a stitch in at the end, and the stitch dissolves after a week or two. And that's it. I have a rule of twos afterwards, the 2 days of just being a couch potato. I did the same thing you did. I think I went to Walmart or something next day. I was feeling good. And then I was like, ooh, I shouldn't have done that. I didn't take my own advice. So just chill for a couple of days. Literally just be off your feet, chill, relax. 2 weeks of abstinence, so no sex. I had a guy in my office ask me, can I masturbate? And I was like, no, so let me be explicit. No relations.
No sexual relations of any kind. Huh?
Some guys, you got to spell it out.
All right, let me ask you a question. That was a great description. And honestly, for guys who are considering it, I mean, I can just speak to it and say, man, it was fairly painless, except when I didn't follow what the doc said. I mean, other than that, it was. I've had more painful experiences than that. One being having COVID. That was worse than vasectomy. But I want to ask you, before I ask you who shouldn't, how does it affect us sexually?
Yeah,
there's a lot of myth out there. What can I expect to happen? Is the flow going to be strong? Is it going to be weak? Am I going to still be able to get an erection? How is it going to affect me sexually after I have a vasectomy?
Sure. And that's a great question, because there's a lot of misinformation out there regarding this. Number one, it does not affect your hormones in any way. So you're not going to get low T because you had a vasectomy. It doesn't cause erectile dysfunction. The nerves for erection are deep in your pelvis. They're nowhere near your scrotum, so you're not going to have erectile dysfunction. It's not going to feel different. It's not going to feel like you're backed up. Brothers talk about blue balls or whatever, like I'm feeling backed up. None of that. You won't have any of that. And actually, speaking from personal experience and, having done it, I can say, I don't know about you, man, but, after a couple of weeks and, let loose, it was like, oh, it was like,
Hey, the rivers are flowing. There's just no
yes.
fish. There's just no fish in them.
No, well, okay, now that's the important part I want.
Is that true or not true?
Not true. Not
Okay.
true. Okay, a common misconception is that after your vasectomy, you're sterile, and you are not sterile afterwards. Remember, I mentioned that. Why
am I doing a vasectomy if I'm not?
You're not sterile right away. So you have. Remember, I talked about how long the vas is, going all the way from the scrotum, going down into your pelvis.
Oh yeah.
Still have swimmers along that pipeline that have yet to be released.
Oh man.
So,
okay.
So I tell guys, after that 2 weeks of abstinence, clear the pipes.
Oh, it's 2 weeks of abstinence?
2 weeks.
I thought you said 2 days.
So hold on. Let's get this straight. 2 days of resting, being a 2 weeks of abstinence, no sex or ejaculation, and then in 2 months, come back in and bring in a specimen. Okay. Now, during that 6-week period, after your 2-week break, it takes about 20 to 30 ejaculations to clear the pipe, to get rid of all the sperm that was distal to where you cut the vas. Okay. So, for some guys, I need to write a prescription for that, because the wife won't do it unless. No, I'm kidding. But
hey, bro, I was gonna say, man, that's almost it likened unto when your wife's trying to have a baby and you're just a willing servant, man. You just want to do whatever. You just want to offer your body as a living sacrifice.
Right.
And then on the other hand, you're like, look, babe, listen, if this is going to work, man, I got to get 20 or 30 of these off. Oh, man, I thank God for the urologist.
Amen. But yeah, it really is real, because I have had guys who did not check. I got a friend that did not check, who had their 4th child. And, so you have to check, because you still may have some swimmers. Now, the way we do it, and I didn't get into how exactly it's done, but after we cut a small segment out, about 1 centimeter out, I put 2 metal clips, very small clips on each side, and I take a cautery pin and I burn the lumen, the hole in the middle, okay? And so you have, it's cut, it's clipped, and cauterized, okay, both sides. So, and then when you release it back into the scrotum, they kind of separate a little bit, And so with those 3 safeguards, you should not get pregnant if you follow directions, right?
Yeah.
Come in 2 months and bring in a sample. And when it shows no sperm, that's when you have the all clear. Only then. So I tell patients, use precaution, use protection, whatever surefire method you have for birth control, until you've gotten the all clear.
Listen, that's that sounds like a life lesson. Like how we there's certain things that we want in life, but because of our lack of patience and we don't follow instructions, man, we get ourselves into trouble.
Yes.
And, actually, you're bringing those things back to my brain. I want to. We have just a few more minutes left, and I want to ask you some direct questions.
Sure.
What warnings do you have, or admonitions do you have for a brother that's contemplating this right now? Not necessarily a warning, but it's some like real serious talk about a vasectomy. I mean, so many brothers, you and I both know, man, they got a lot of superstitions and a bunch of other stuff, but at the same time, they can't stop having kids, and they want to.
Yeah.
Any real talk you want to share with the brothers about the vasectomy?
Man, there's just freedom in sterility for me. And, I know you find that as well. Just knowing that you are in control of your body and the outcomes that you want. And so, there's a lot of fear, but most of it is in the head. It really, it's not really based in reality. We fear what we don't know. And so hopefully this information will eliminate some of that fear. But my main thing is know for sure. If you're wavering, don't do it. If you're not absolutely 100% sure that you're not trying to have any more, then I would wait. It's just not worth it, because the longer you go after a vasectomy, people ask, can it be reversed? And it can. The best time, the highest success of reversal is within the first 3 years. And it's 75% success rate at that. It goes down the longer you wait. So, you wait 5 years, it goes down to 55%. And you 10 years, it goes below 50. So, know for sure that you want to have this done. And it's nice if you're married that your wife agrees,
All right.
because, there's some, I try not to get in between that, but
hey, man, it was real easy for me, man. After we had our second child, my wife was like, man, you ain't gonna get none of these Skittles, man, unless you go get clipped. She was like, I already put my body through hell. She was like, it's your turn now, man. So I willingly, man.
Yeah.
I went willingly, brother. That was easy motivation for me.
Yes. I think as men, it is one of the most selfless things that we can do, because honestly, it takes 15 minutes, and it's an in and out procedure. Women have to go through surgery. They got to do all this stuff. And I get a lot of guys that's like, I don't like seeing my wife, hormonal. I don't like, or we had a high risk pregnancy. I'm not running the risk again of putting her in danger. Financially, I can't afford it. I can't afford more kids, So those are excellent reasons to proceed. But you definitely want to go to, because you do hear some horror stories, about just things going wrong. And so you definitely want to find a urologist that is experienced, that does a lot of these, multiple times a week, so that, and they don't have a high complication rate. Because some of the, I do need to say two things, because, just for completeness sake, 1 in 100 men will have a chronic pain after a vasectomy. Okay, so 1% of men, chronic testicular pain, bilateral or unilateral. And we don't even know why that is, but some men do. And sometimes it just burns out on its own, and, there's nothing, a little Advil can treat that. Sometimes you need to do cord blocks, or actually, put some numbing medication in the cord to block the pain, a series of those to get rid of it. But that does happen, and you can develop some bleeding and bruising afterwards. And so that's why we tell people, take it easy for a couple of days. Don't get up and move, and don't try to have sex too early, because things are healing. So you don't want to create pressure and blow out something and create bleeding either. There's a very low chance that, with the way that I described, that the vas ends can come together and recannulate. But one thing that has been basically studied is that if you ejaculate and you get seepage of sperm outside before everything is scarred down, you can form this granuloma, which is like this ball of inflammatory, material in sperm, and that granuloma can create a bridge between both ends of the vas, and you can start to have channels around where you had the vasectomy. And so that's why it's very important to listen to the doctor, take those 2 weeks off. It's going to be hard, but you'll live, and do it the right way, because you don't want to go through that for naught.
I think one of the most powerful things that you said tonight, that I didn't really even think about it like that, is that, our wives, they put their bodies through so much, and it is a selfless act. And so for the guy who's thinking about this, I think Doc has really helped us to see the nobility, the virtue in doing this for the sake of your family and to give your wife's body a break. I'm just guessing, but you would know, is it more expensive to get tubes tied than it is to get a vasectomy? Okay.
Anytime you're going, the only time I would even suggest a woman do that is if she's already, having a C-section and she's in there, and you can just put the tubes at that time. But, vaginal birth, if they're not even close to it, it's much easier for us to take care of that. And the first thing I tell patients when they come in is say, so you want to take one for the team, huh? That's literally what we're doing.
What we're doing. I tell you what, man, I'm happy.
Yeah.
There is a freedom, brother. There is a freedom, and I just have no worries whatsoever.
Amen.
You know my wife, man, she's heard some horror stories, and she said it to you, and you had to tell her, look, he's good. She heard some horror story about after 7 years or something like that. Now, is that true? Like after 7 years, like is that true? Is there a 7-year period where, you're more susceptible to, you have to go get checked again? You have to go get checked again?
No, you shouldn't.
You see, man, all this stuff, man, these old wives' tales, man. Maybe she's just using this to block me sometimes. But anyway, look, we got to go, man. This has been great. We're going to bring you back. We're going to talk sexual health, ED, prostate cancer. So fellas, stay tuned, man. We're going to see more of Dr. Q with us. So, yeah, man, appreciate you, man. Much love to you.
Yeah, man, love you too, bro.
Yes, sir.